Hello guys, welcome to your own clinical YouTube channel. Today we'll be discussing about the pacemaker codes, the various coding systems commonly used in permanent pacemakers which are relevant to clinicians. So, what you are seeing in this image, as you can see the green arrow, it is written DTD on the device. So, it is basically a code, three-letter coding system that is written on a permanent pacemaker. So basically, three-letter coding system, four-letter coding system is also there, and five-letter coding system is also there. But most commonly we use three-letter coding system, right? So basically, in the five-letter coding system, there are five components: first, second, third, fourth, and fifth, right? Okay, so the first letter signifies the pacing. Okay, whether it can be pacing to the atrium or the ventricle or dual, means both A and V, atria and ventricle. So the second letter represents sensing. Again, it can sense the atria or ventricle or dual or non, right? So first letter is pacing, second is sensing, third is response to sensing. So basically third is what it does after a sensing. It can be inhibited, it can be triggered, it can be dual, or it can be non, right? So after sensing, the third letter is response to sensing, which either can be represented as inhibited form, triggered form, or depending upon the scenario it can be triggered and inhibited, which is dual or non. Okay, the fourth code represents, it is programmability, or also called rate modulatory function, which is basically a rate modulatory function that is varies its output depending upon the physiologic need of the body, mostly with respect to the minute ventilation or with respect to the exercise. Okay, and the fifth function is arrhythmia control or anti-arrhythmia or anti-tachycardia function. Okay, so basically in five letter coding system, the first is pacing, then sensing, then response to sensing, then programmability or rate modulatory function with respect to physiologic needs or exercise, and the fifth one is anti-tachycardia function. Anti-tachycardia function, it can be either pacing or it can be shock or dual, pacing and shock. Okay, so let me explain in an example. Let us consider a mode of VVI. So what does it mean? Ventricle is being paced, ventricular pacing. Then second code is for sensing, that is ventricular sensing. Then I, which is the response to sensing. What is the response? That is I for inhibited. So the ventricle will be paced and the ventricle will be sensed, and as a response it will be inhibited if there is a sensing. Okay, so if we add a fourth letter, that means V, V, I, R. So what is R? The fourth function, that is the programmability, means it is rate adaptive. So in this there is a mechanism which is installed to match the physiologic need. Okay. Another example we can see, if it is a DDD mode. So pacing for atria and ventricle both, sensing for atria and ventricle both, and response to sensing will be dual, means it will either inhibit or trigger depending upon the clinical scenario. If the SA node and AV node 2 are functioning properly, then it will just sense, it will just do nothing, it will just sense. But if the SA node or AV node they are not working properly, then it will take over and it will deliver a fixed rate. Okay. So let us consider if a patient is there in ICU and some surgery is being planned. So what mode to be set for intraoperative period? So in OT there are multiple things are there to interfere in the electrical circuit. One example is cautery and other movements, right? So what mode for surgery? Mostly they prefer VOO mode to be set because we do not need a sensing function. So no sensing function needed. So in this mode, ventricle will be paced at a fixed mode. We do not need any sensing function, so that to avoid interference with the cautery system or another electrical circuit involved in the procedure. Okay, so intraoperatively we need VOO mode where ventricle is only paced with a fixed mode. Okay, and remember to deactivate if any rate modulatory function is there. So intraoperatively there are two concerns. One is need to activate VOO mode, which is a fixed mode, and second is deactivate the rate modulatory function. Read more about it. Thank you.